welcome back to the channel. This is Joy, and y'all, I keep going down this rabbit hole with Eugenia, and it's getting crazier and crazier. There's a lot of information over the last couple years that I've not seen, so I'm doing my best to try to dive in and see as much as I can. And if you guys haven't seen it yet, make sure and go see part 1 and part 2 of this video. I have kind of a little series I'm doing about this, and I'm going to give you insight into what might be going on with Eugenia and eating issues themselves that you won't hear anywhere else. Well, I don't ever hear anywhere else on YouTube, so make sure and go check those videos out. I'll have links in the description. I'll have links in the cards, so if you click on the cards, you can see those. But we're going to continue to dive into this rabbit hole. And it's weird because I'll start to see something. I'm like, okay, that looks like a possible good video topic. And then 5 more things pop up. And that's like every day that I'm looking. So I'm kind of, again, I'm wondering if this might be a little bit of a series. I want to be careful because I don't want to do anything within disrespect to Eugenia. I think a lot of these videos coming out about her, I think many creators are well-intended and they want to see her get better. However, I also think many people are taking this as a time to use criticism as just being mean to people. Now, here's the thing. I'm not saying all criticism is that, but there's a difference between constructive criticism and being concerned versus hiding, right? Just kind of hiding your mean intentions. And I think a lot of YouTubers can fall into that. Not all. I do think people are concerned. And the big question right now is, it sounds like a lot of the creators are trying to petition to get Eugenia kicked off of YouTube. Is what she's doing worth calling for that? And why do we pick and choose which eating issues we should go after? And by the way, here's the thing. Until I have all the information, or as much as I can, I'm not going to fully form an opinion. My opinion right now as it stands is, coming from somebody who's had eating issues, most females in general have had some form of eating issues. A lot of men too. Hashtag, men as well, or whatever. Why do I always do hashtag? I guess it's because of the Me Too thing, right? But men go through it as well. But it's so common with women. It is so common, and I detail some of the reasons why it's common. So for instance, and I have this in a video, I actually have a scientist who speaks out about this and gives the data, that all the data we have on weight loss in our culture, it's all tailored to how men lose weight and then losing a lot of weight before surgery. Like, we don't really know much about women's health, so women really, really struggle in the weight department, which that in itself could cause the mental illness, the OCD, the obsessive compulsiveness, and then just going to the extreme to try to fit what you're supposed to be. On top of that, then society, our parents, our grandparents reiterate, everybody says, oh, well, you can't lose weight, just eat less. I can't tell you how many comments I've gotten of people saying, my parents, my grandparents, everybody had that same way and modality of thinking. And some people said they think EDs are genetic. While I think that's an interesting point and there might be a genetic component, I also think this is just culturally being passed down to us, because women, remember, it's only been the last 100 years we could vote. And look at what we've done to minorities. Look at where even female minorities are, and women, our healthcare isn't looked at. We are devalued a lot in society. So I kind of want to cover this topic because I think it really goes into a bigger topic of health and health for women. And I think that's important information for people to know. But I want to say I really like Eugenia. And I've said this in every video. She's been kind to me when other people haven't. I think Eugenia means well, and I think she's well-intended. And for whatever her situation is, she is probably doing her best. However, that's not to say what's going on is okay and that it should continue to go on, because she is in that place of being an influencer. She is trying on clothing. She is modeling clothing. She is using her body to show you, this is what clothing is going to look like on me. And young girls who are impressionable will see that and say, I should look that way. I get the arguments and I agree with them. My concern is always, how far do we go with this Pandora's box? Do we then start kicking off people who are overweight and open with their weight issues? Do we start kicking off Billy the Fridge? Do we start kicking off Boogie? Thank you. Somebody in the comments brought up Boogie2988 and Nico Avocado. By the way, I'm not saying they should be. More respect to all these people. Billy, within reason, has been kind to me. Boogie, I've had a couple interactions with him on Twitter, been super sweet. I'm not putting any of these people down, and I'm not saying they should. Or what about the people who have the eating issues and you can't see it, which is a lot of women. A lot of women are struggling with their weight and they have the same eating issues, they're just not getting stick thin. Well, is it okay because their body is presenting a certain way? And I'm raising questions. What I like to do is I like to go in and try to dive deep into something, play devil's advocate, and figure out where the truths, where the BS, and then ultimately where the wisdom lies to be able to take action. But I think everybody's concerns over her situation and what's going on are valid. So I feel like I always have to do this like 5-minute dissertation just because I want you guys to be aware this is something I'm taking very seriously and I know is a very sensitive topic. I just think we don't go far enough with understanding eating issues in our culture, in our country, in North America, and some of the underlying issues, the physical causes. I'm all about let's fix something, right? And sometimes I think the issue isn't just we have to fix the mental stuff. Mental stuff typically, mental illness, mental issues typically go hand in hand with this, right? But sometimes people have eating issues because it's physical. And sometimes the mental illness happens because there's a physical component to it that we don't know about and we can't see. And that's the stuff I like to educate you guys on, stuff you're not going to hear other places. So, okay, so with that being said, also I want to let people know because we're talking about these subjects and we're going to be showing some video. This could be, this might not be good for certain people who see these type of images and react a certain way. So I just kind of want to put that out there within caution to everybody. I understand certain things could cause a person to react a certain way. So, okay, so here's what we're going to talk about. So this is what I was seeing, and I kind of want to go into this because I do find it interesting, and I find it something that I have been finding has been happening to me a lot lately. We're going to talk about Eugenia's health on her live streams. So I'll tell y'all, live streams are really interesting. I like live streaming, and it can be fun. Probably won't get back into it anytime soon because I feel like it's also, it can kind of be a playground for people who aren't very nice to try to like provoke you and get you to react and take and twist your words and things. And honestly, with where my health is, I've had a bad health week. Like I said, I'm better, but I'm really weak and don't have a ton of energy. So I'm just doing enough to do these videos. My other channel I haven't uploaded on at all simply because of that. But I don't know. I feel live streaming is kind of a double-edged sword, especially if you're somebody like Eugenia who outwardly has these issues. Now, as we know, Eugenia is a live streamer and YouTuber, and she has eating issues. And she has been talking about this for quite some time. By the way, I'm going to be kind of roundabout talking because it's YouTube. So just please infer some of the things I'm saying. I hate that I have to do this, but this is what it is being on YouTube. So she's got eating issues. There was a lot of talk for several years that she did. It was somebody that very much defended her, saying we don't know what her health is, and that's her private business. But as time has gone on, number one, she did a documentary with Shane. She admitted to it. She finally admitted to it. And number two, since that documentary, she is looking remarkably worse. And she's starting to have what are looking like some neurological and physical issues on stream. So people are starting to say that they think she's having seizures on stream because she's being caught stuttering. Now, I can argue this back and forth because I'm somebody, Eugenia sometimes speaks quickly. Not as quickly as me necessarily, but you guys know me. I can talk pretty quick. I'm a pretty talk quicker. I just did it. I'm a pretty quick talker, right? And sometimes in that, or especially if I'm really not feeling well or I'm having my vagus nerve issues, which is neurological, I can stutter a little bit. You'll see it in some of the videos. Or my mouth can be dry and I get a little tongue-tied because I'm having histamine issues. So I can say as somebody who has this happen to them on camera every so often, a part of me is like, it can feel like people are really nitpicking her and just picking her apart for anything they can find to get views. However, and so I want to say that, and Eugenia even kind of talks about that, right? However, I do want to go into this because I do want people to know that one of the side effects that an eating disorder can have has to do with seizures and stuttering. And while I've never been diagnosed with a full-blown seizure with the condition I have, you can go into seizures. And I've told you, I feel like I'm having near seizures and near heart attacks. The near heart attacks I found out was correct because during one of my episodes where we got to see what my EKG was doing, I was going into, I think it's called SVT. It's, I'm not a doctor, it's SBT. I think it's V. It's a specific heart rhythm where your heart rate is going too high and you can go into a heart attack. So I have a lot of sympathy if this is happening or for somebody who's had this happen because I know that fear of something, I'm having a flare up, what's popping up, what's going to come from this. So when you have heart issues like mine, all kinds of, and it's from your neurological system can do all kinds of crazy things, unfortunately. So I want to go ahead and dive into this, but let me give you guys some information first so you have this, and then I'll show you what the proof some people are talking about, not just about seizures, but also about her physical health and where it is. So let's go ahead and let's take a look. What exactly is a seizure? So here we go. This is just from Google. It says, a seizure is a burst of uncontrolled electrical activity between brain cells, also called neurons or nerve cells, that cause temporary abnormalities in muscle tone or movement, stiffness, twitching, or limpness, behaviors, sensations, and state of awareness. Let's go ahead and go in. Why do you suddenly have seizures? Anything that interrupts the normal connections between nerve cells in the brain can cause a seizure. This includes a high fever, high or low blood sugar, or brain concussion. But when a person has 2 or more seizures with no known cause, that is diagnosed as epilepsy. And this is really interesting because when it comes to having eating issues, something that can happen, aside from like in my case, I have neurological issues where sometimes my body has a hard time regulating its temperature. If you guys remember my former videos, I'm like, I'll run low-grade fevers for a couple weeks and it's exhausting and I don't know what's going on. But that also includes your temperature many times will be too low. And my temperature is always below what it's supposed to be. But there's also a lot of science that over the last 100 years, that basal temperature has changed as a result of us having like air conditioning and heat. So there's a lot of interesting information about what that number should be at this point. But the other thing I want to talk about is high or low blood sugars. So many times people who have eating issues have issues with anemia or issues with low blood sugar. They'll have low blood sugar or they'll have blood sugar issue drops. So I did want to point that out. I know that from myself having these issues from before. Now I want to go into what happens during a seizure. A seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in your behavior, movement or feelings, and in levels of consciousness. If you have 2 or more seizures or a tendency to have recurrent seizures, you have epilepsy. There are many types of seizures which range in severity. So now I want to actually play some of the clips that I've been seeing where people are saying that these are, this is evidence that she is having a seizure and that something is wrong, and her even kind of talking about it. So let's take a look at some of these clips and then I want to go into a little more science. Let's hear it.
To him and like he liked me, then like yeah, said oh. Guys, I think I might have like an allergy or something. Happy Halloween for me and my 2 puppies. Aw, happy Halloween to you too and your puppies. I feel like they're kind of going through like this weird, like really uncooperative like time, and it's like kind of annoying. Guys, I've been streaming like almost 5 hours. That's crazy. I guess like looked at that and I'm like, wow, Eugenia. It's streaming from, but it's also crazy. You'd be surprised. Yeah, see, that's definitely, I think that's pretty kawaii. But I don't know, like people kind of have like different, like I guess like ideas of kawaii. Good to try to keep your brushing your teeth. Like it's good to keep your teeth in good condition, It's never too late, Eugenia. You can do it. Thanks, Angel and Angelvita. I appreciate it. Last year was a really year for me and stuff, but I'm definitely doing a lot better and stuff. So I mean, I'm doing a lot better. Like I'm doing good and everything. Some people just like literally analyze like everything. I'm like, I can't move without people. I move my arm and then I'm having a seizure to some people. That's another thing people like to say lately is that I'm having a seizure, which I definitely have not had any seizures on stream. But I'll even have like some people that will tweet me and they'll be like, yeah, you're having seizures, Eugenia. And I'm just like, I don't think I've had a seizure, guys. Like I really don't. And you, by the look of your seizure, guys, I don't know. I'm not trying to be mean to you guys. I'm really not. But just so you guys know, I'm not in a rude way, but I don't know if some of you guys know what seizures are. Because I can tell you, I have never had a seizure on stream. Which is good because I feel terrible for anyone that's had a seizure. But I have never had a seizure on stream, so.
So it's interesting because some of this doesn't sound necessarily, because I'll get tongue-tied, right? Or you heard me kind of mix up the words. But some of this sounds like it's a stutter where she'll try to say the T sound and it's t-t-t-t-t, and she's having a hard time getting it out, right? I mean, I don't know. Are we nitpicking? And how long has she been stuttering? It seems like this has been a new occurrence that this can happen. But yeah, when your body doesn't have enough of what it needs to function anywhere, your nervous system can go crazy and things can start misfiring in the brain and electrical activity. And when I say misfiring, it can have low function because you don't have enough, or then a burst of adrenaline because your body's like, hey, do what you gotta do, and then things start going nuts. Some of that I feel like can tend to happen with me and my heart issues. Like when I have a POTS dysautonomia flare, the heart rate and the blood pressure goes up and down for a while because it's your body trying to figure out how to regulate the fact that something's wrong, that you've had a drop in something, right? So and I'm not saying POTS and dysautonomia is the same, I just know that those issues that I have neurologically can cause seizures. So you have to be really careful. I'm just relating it to what I've been through. But I actually pulled up some brain scans and a doctor who goes over certain issues where people are stuttering and what they're talking about with brain scans and what this could mean. So take a look at this. I find this interesting.
Hello. So it's been a while since we've done any EEG tutorials, so I thought I have an interesting case and I'll share with my audience. So this is a 70-year-old woman who was brought to our university hospital with complaints of episodic stuttering of her speech. So she would be talking normal and all of a sudden she would start stuttering that would continue for 20 to 30 seconds and then she would come to. With some of these episodes, she would recall the event. With others, she would have no recollection. It was not clear whether she had difficulty finding words or was it just the stuttering speech. So she never had a problem with stuttering in the past, and this was a new presentation. So let's have a look at the EEG, and I'll let you figure out if you have an answer for her problem. So this is looking at a bipolar montage. You have all the odd numbers recording electrical activity from the left side of the brain, all the even numbers recording electrical activity from the right side of the brain. These green lines are separated by 1 second, and so let me start moving onwards. So we are moving 10 seconds at a time. Keep looking at both the left and the right hemisphere. See if you are able to figure out the problem. Okay, so the EEG starts showing abnormalities on this page. We go on to the next page. It becomes a little more evident here. And we keep going on and on and on. So I wonder if some of you have already identified the problem. In fact, the EEG still shows some changes, and that is almost gone. So if you've not been able to identify the problem, let me go back. So now focus on the left side of the brain. So the left side of the brain is the odd numbers that you're looking at, and we'll move onwards. And the first change that you see is about to show up right here. You see some fast frequencies that are seen in the left parasagittal region. This is the frontal central parietal region where you see these fast frequencies. And one of the definition of an electrographic seizure is rhythmic activity that changes in amplitudes and frequency, has a clear beginning and a clear end. So let's move a bit, go back a few seconds. You start seeing the changes right here. And these are the high frequencies that I'm talking about. And as you move onwards, compare the amplitude. So look at the amplitudes right here, and then look at the amplitudes right here. So you see a change in amplitude, you see a change in frequency, and you see an evolution. In fact, it appears that it's also involving the right hemisphere to some degree over here. But the majority of the changes are in the left hemisphere. These continue, goes on and on for almost a minute. It gets quite slow on the left hemisphere now, and you see the slowing, and that it's almost over. So this was an electrographic seizure that corresponded to the episode of stuttering in this woman. Now let me show you the MRI findings to correspond with the EEG changes. So what you see here is the MRI of this patient, and in the left frontal head region, this is where she had a previous stroke that left its mark there, and we can see it in another cut close to the midline, and as we go on a superior cut you can see it is just more of a cortical stroke on the left frontal head region, and this is what was producing all her symptoms. So this is a good example of a seizure from the left frontal head region producing an episode of stuttering. Seizures coming from the left temporal and left frontal head region can also present with aphasia and should be considered in the differential diagnosis of transient ischemic attacks. I will finish off the video with just suggesting that keep your differential diagnosis open. If there are neurological symptoms that are episodic and are stereotypical in presentation, consider the possibility of seizures. That's all folks. I will see you at my next tutorial. Bye now.
Okay, so right now that's the evidence that Eugenia is having some sort of, seizure on stream. Obviously, like everything I've said about Eugenia, I don't think it's enough proof of anything. I understand why people are concerned, but then here's another interesting part to this, and by interesting, it's kind of scary. People are saying that she is showing signs of dehydration, which dehydration very much goes hand in hand with these eating issues that she's admitted to. Let's see those signs.
The back of the heel is actually lipstick. It's not real lipstick, so you can't actually use it on your lips, but the back of the heel is actually lipstick. It's not real lipstick, so you can't actually use it on your lips, but the back of the heel is actually lipstick. It's not real lipstick, so you can't actually use it on your lips, but your heel, it's like a heel lipstick.
Now this is very interesting because there's a couple things that I want to bring up with this topic. Because I think there's some good info to go into. So first of all, I have an article, Can Eating Disorders, start with A, cause seizures? And it says the eating that starts with an A is an eating issue that can lead to numerous health issues. Side effects of it can be unexpected, including the development of seizures. Someone who has the A word may experience seizures even if they do not have epilepsy or epileptic condition. And then it says the A word side effects, causes of seizures. This is why I'm going into this, dehydration. Dehydration occurs when the body does not get enough fluids. Many people who have this condition starve themselves, don't drink enough water, take laxatives when they shouldn't, or other type of medicine they shouldn't, and they force themselves to. All of these behaviors can deplete the body of necessary fluids and cause dehydration. When the body is dehydrated, the kidneys and the heart can fail, and seizures can occur. Malnutrition. A person who has this does not eat a balanced diet and therefore does not give their body the nutrition it needs. Chronic malnutrition from irregular eating habits, including eating too little or too unhealthy foods, can lead to fainting or seizures. Refeeding syndrome. People who have this may experience, the eating issue, may experience instances of refeeding syndrome. This syndrome happens when somebody who has been starving quickly eats many calories. Refeeding syndrome can send the body into shock, causing regular breathing, heart failure, and seizures. Medication. Some antidepressants medication can cause seizures in people who have the A word. Given that most drug side effects are listed, including the risk of seizure, it's up to the person to decide whether the benefit outweighs the risk. So now I also want to go into what I think is very interesting, and this has to do with the A word and 5 potential medical complications of the A word you may not know. They talk about anemia, like I go into. They talk about constipation, and that makes sense because you can't really create a bowel movement if you don't have enough food to do that, right? But then we get into dehydration, so let's see. Most people might think of dehydration as not taking enough water, or more specifically, when someone loses more water through etc., than they ingest. While this is true, a large percentage of dietary water also comes from solid foods. When someone restricts their food intake, they become more susceptible to dehydration. Dehydration can manifest in a number of symptoms, including thirst, dark-colored urine, infrequent urination, fatigue, dizziness, and confusion. In more serious cases, it can cause a number of secondary complications, such as kidney failure, hypovolemic, low blood pressure, shock, electrolyte imbalance, and orthostatic hypotension. Treatment of mild Dehydration generally begins with adding oral fluids and fortifying the patient's diet with intravenous fluid that's required in more severe cases. Electrolyte imbalance. So listen to this because this goes hand in hand with dehydration. Electrolyte imbalances, which are closely linked to dehydration, also commonly result from restricted diets. Electrolytes such as sodium, potassium, calcium, and chloride are essential for the body to function properly. If those electrolytes are not sufficiently represented in one's diet, as is often in the case with NA, the levels will dip and the body's delicate balance will be thrown off. The most frequent electrolyte imbalance seen in people who have the A word are hyponatremia, a low concentration of sodium ions that impact the brain's function, causing confusion, headache, fatigue, irritability, muscle weakness, and or cramps and seizures. Hypokalemia can impair muscles, especially heart function, causing muscle weakness and cramping, and irregular heartbeat, abdominal cramping or bloating, thirst, and frequent urination. In addition to a balanced meal plan, electrolyte imbalance can be treated with dietary supplements like sodium chloride for hyponatremia or for hypokalemia. In extreme cases, IV therapy is suggestion. One more thing I want to go into. So now we want to look at when they talked about her skin being dehydrated. So let's look at this. This talks about skin and dehydration. So it says dehydrated skin means that your skin is lacking water. It can be dry and itchy and perhaps dull looking too. Your overall tone and complexion may appear uneven and fine lines are more noticeable. Why dehydrated skin can be a nuisance. It's relatively easy to treat with the right lifestyle changes. Again, but dehydration can be totally different when you have an eating issue because you might have electrolyte imbalance. There's all kinds of things you might have as a result. Treatment begins from the inside out to replenish and maintain hydration throughout your body. Dehydrated skin can appear dry, but it's not the same as having dry skin. Severe dehydration and dry skin should be addressed with a doctor. Now, dehydrated skin versus dry skin. It says dehydrated skin is sometimes discussed synonymously with dry skin. However, these are two different phenomena. While hydrated skin lacks water, dry skin lacks natural oils, also called sebum. Also, dry skin is a type, while dehydration is considered a condition. Skin types are classified as normal, dry, combination, and oily. You are usually born with one type of skin, but it can change with age and season. When you have dry skin, your sebaceous glands don't produce enough natural oils. Your skin usually needs help with added hydration via emollient cream to protect from further moisture loss. Dry skin can also be caused by underlying health conditions such as hypothyroidism. Hormonal conditions such as these don't cause dehydrated skin. Signs of dry skin include scaly skin, white flakes, redness, irritation. Dry skin is sometimes associated with skin disease such as psoriasis, eczema, and even post-acne breakouts. However, these aren't the same as having the dry skin type, nor are they the same as dehydrated skin. At its definition, dehydration means that your body is losing more water than it's taking in. Aside from not drinking enough water, this can be related to increased urination from caffeine or diuretics. Again, something that can go hand in hand with eating issues. It may also occur from lots of sweating from exercise. Unlike dry skin, dehydration can cause the following symptoms: itchiness, dullness, dark under eye circles, sunken eyes, shadow around the face, especially under the eyes and around your nose, increased incident or appearance of fine lines and surface wrinkles. And look at this, guys. A lot of this is really interesting because when it comes to her skin, first of all, there's color issues. A lot of people are talking about there's kind of a like translucent gray color. The darker under eye circles, definitely there. The sunken eyes, the shadows around the face. I mean, a lot of that is prevalent with her. And severe dehydration can go beyond your skin and cause symptoms such as dizziness, dry mouth, faintness, lightheadedness, overall weakness, urination that is darker and less frequent. Dehydration can become a medical emergency in these cases. See your doctor immediately if these symptoms of severe hydration don't improve. That's another one that's kind of interesting, is that if she was feeling dizzy or dry mouth or lightheadedness or weakness, all of these things for me can make me trip over my words. And again, that's different than having necessarily the same type of stutter. From the research I was doing, a lot of it would be the first consonant and having a hard time getting past that, like a T. So it's a little bit different, but still it makes sense, and it kind of makes sense to her overall appearance. Now, how to test if your skin is dehydrated. You can do a simple pinch test at home to determine your skin's hydration levels. Take a small portion of your skin around the cheek area and squeeze lightly. If you notice any wrinkling and if the skin doesn't bounce back after you let go, then your skin might be dehydrated. Your dermatologist or esthetician can also help you figure out if your skin is dehydrated or dry. Now, I know that's a lot of information, so I'm not trying to bore you guys, but I wanted to go over that because I thought that article brought up some other interesting parts about her skin. So first of all, with her touching her skin and having those marks and not bouncing back that quickly, that seems like that could be a sign of dehydration. But then look at some of the other symptoms about the sunken eyes, the dark circles around the eyes, all of that. You know, the fact that her skin is, and I'm not making fun of her for being light. I'm very light skinned. It's probably better than what it used to be because now I haven't been doing it as much because it's cold, but I do sunlight therapy in the morning for histamine. Sunlight therapy, basically I just stand outside in the sun for an hour or two and get as much sunlight as I possibly can. It has all kinds of awesome benefits from like 6 a.m. to 10 a.m. But it's cold, so I've not been doing it as much. But, you know, your skin color, and her skin color isn't just light. She'll kind of laugh and shrug it off and say, I'm a vampire, I don't go out. Which I get, you know, and that makes sense, but her skin is very gray and pale and kind of translucent looking. And that can also have to do with eating issues, having those type of skin coloring issues. And that's not me making fun of her. I think she's a beautiful girl. I'm saying it kind of adds some credit to some of this. So are all of these things proof? Because people are running around screaming, proof that Eugenia blah, blah, blah. I can't say for sure. I'm not her doctor. I do know the more I look into this, the more concerning this situation becomes. I've started out, like I said before, Eugenia had admitted to having an eating issue. I started out very much defending her because I said, look, she could have a health issue that makes her that thin and she doesn't want to talk about it. And considering I know what it's like to put yourself on the internet, talk about your health issues and people be that mean, I understand why she would want her privacy. But now that she's admitted to this and she's never said there's a physical cause to this, seeing all of this and seeing her body start to get worse with an audience of young girls that's receptive to that is extremely concerning. The question that comes up, that's continuing to come up is, should something be done about it? Should YouTube take action on this? Should her other social media platforms remove her? I'm afraid that's opening a bad Pandora's box. But I also understand the concern, and I also understand why people would want to do that. So I don't yet have an opinion. I haven't formed an opinion one way or the other yet on what should happen, and I'm probably not qualified to do that, honestly. But the more I look into it, I will say the more and more concerning this stuff gets. Okay, guys, if you like this video and you like my breakdown, please give me a big thumbs up, like the video, and subscribe. And then hit the notification bell when you can subscribe and turn them all on so you can make sure and see when I upload different videos, and hopefully it's stuff that you would enjoy. Also, comment. What do you think? Do you think this is actual proof that she's having seizures and all this is happening? Do you think people are going overboard and they're just kind of, you know, some people are just trying to drive up a hate train to get views? I don't know. Sound off in the comments. I'm really curious what you guys have to say about this. And or do you think that this is completely off? Because again, I don't think it's yet proof. I think it's concern. I think there's just more and more concern. And you know, I think not every time, but sometimes when there's enough smoke, there's fire. But I'm also on the side to not jump too much on the bandwagon because I know what it's like for people to say, look how much smoke there is with me, and the majority of the smoke being made were lies. But in this case, there's actual things going on we're seeing that don't add up and don't make sense. But then again, my conditions, I can't tell you how many pseudo doctors or people who claim to be nurses or this or that and said, we know Joy's lying because what she's saying doesn't make sense, it wouldn't happen. Well, for my specialized condition, it makes perfect sense because a lot of things don't make sense with my condition. So I have a hard time wanting to jump on any one bandwagon. I will say that I think we should take eating issues seriously, but I also think as a society, we need to have a deeper dive into eating issues and look into what's actually going on with our physical health. But then again, I think we're a society that needs to go ahead and just focus more on physical health. I mean, I think it's evident how much we lack that in our society by the fact that we're in a pandemic and most people are uninsured. Who can afford it? Who can afford it? I don't know how many people who are like me who haven't been to the dentist in years because who can afford it? Who need glasses? But I'm like, well, what is it? Is it nearsighted? I'm the one where you don't see far away very well, and I'm like, well, if it doesn't affect me for the moment, who can afford doing that, you know, once or twice a year? So I just hope we put more emphasis on physical health, and I also hope we put more emphasis on trying to build women up in society as well as minorities. That's something that I'm really big on at this point. So yeah. But I just wanted to go ahead and throw this out there and see what you guys think. And if you guys like these videos, I'm going to continue to look down this rabbit hole and see what's going on. And again, I respect Eugenia. I like Eugenia. I think she's well-intended. Whatever's going on, I hope she is getting the help that she needs. And I hope that this situation, you know, doesn't get worse for her. I really do wish her all the best. And I'm really just trying to show you guys as much information as I can on the rumors you're seeing so we can have a clear picture. And I wish everybody well. Okay guys, take care and blessings, and until the next video, I am wishing everybody so much love, blessings, and I'm gonna give you guys hugs, mwah, and kisses. Bye guys!